Hiccups in children are common and usually harmless. They often result from excitement, swallowing air, or consuming food too quickly. Trick to stop hiccups. Please watch this vlog. Dear viewers, my Facebook and YouTube channel were created on your special request in 2020 amid of COVID-19 pandemic. You are requested to like, comment, share and subscribe. Thank you. Treatment of hiccups, हिचकियाँ और इसका इलाज. Bismillahirrahmanirrahim. Assalamu alaikum viewers. Dr.S.M.Zafeer with you and you are watching my informative vlog on Facebook and YouTube channel. Hiccups in children are common and usually harmless and they go by their own. They often result from excitement, swallowing air or consuming food too quickly. Newborns often experience hiccups, and you must have noticed it, which are normal and tend to fade on their own. It can be caused by feeding, swallowing air, or even changes in temperature. If a newborn is sick and experiencing hiccups, it could be related to various factors such as reflux, respiratory issues, or general discomfort. Now, some of these triggers include eating food too quickly, hot or spicy foods, indigestion, overconsumption of alcohol, fizzy drinks, cigarette smoking, stress, and bad odors. They can trigger the hiccups. Sometimes, although not always, hiccups that persist may indicate the presence of another medical problem. Some illness for which continuing hiccups may be a symptom include pleurisy of the diaphragm, pneumonia, uremia, alcoholism, disorders of the stomach or esophagus, and bowel disease. There is a strong and independent association between hyponatremia, that is, a low salt in the blood, and hiccups in hospitalized patients. Now, how to stop hiccups? Number one, breathe into a paper bag, but do not put it over your head. That means take a paper bag and keep breathing inside. Number two, pull your knees up to your chest and lean forward. Number three, sip ice water. Number four, swallow some granulated sugar, like 1 teaspoon. Number five, bite on a lemon or taste vinegar. Number six, hold your breath for a short time. To stop hiccups in newborn, try calming techniques like offering a pacifier, adjusting feeding positions, or gently burping them. If hiccups persist, consult your pediatrician for guidance and rule out any underlying issues. So take-home message is, number one, hiccups in children are common and usually harmless and they go away by their own. Number two, one effective method to stop hiccups is to take slow, deep breaths, then exhale fully. Number three, alternatively, sipping cold water, holding your breath for a short period, or swallowing a teaspoon of sugar may also help. Experiment with these methods to find what works best for you. Newborns often experience hiccups, which are generally normal and tend to fade on their own. But if a newborn is sick and experiencing hiccups, consult your pediatrician. Stay blessed. Thanks for watching my informative vlog on Facebook and YouTube channel. If you like this video, please subscribe and share.